Hello friends, so this is Dr. Shivaam signing in, and yes friends, the time has come that you should start reading those important and relevant steps that are going into your mind from long before. I would suggest you to spend some time in silence, in solitude with yourself, and believe me, you will come to know what you should read at this moment of time. At this present moment, you should have dearth belief in yourself. At this present time, it does not matter that what is your attempt, whether it is your first attempt, whether it is your second attempt, or whether it is your third attempt. Everything what matters is the mind setup you are having, the mind setup with which you are going to give your exam. See, I'll tell you one example. अगर आपको एक लड़की पटानी है तो बोलिए खुद से पटाऊंगा. अगर एक लड़का पटाना है तो पटाऊंगी. ये नीट पीजी निकालना है तो निकालूंगा. देयर इज नथिंग लाइक half hearted attempt. You are not going to give half hearted attempt at this time, and this will require a lot of hard work, I know, but why not to give it, man? You are outside your home studying somewhere in a coaching institute, taking a hostel room rent. What else you have to do? Only study now. So study karo, padhai karo, and I believe you can do it. But my sincere suggestion will be, do not give half-hearted attempt this time. So लड़की पटानी है, पटाऊंगा. नीट पीजी निकालना है, निकालूंगा. So many of you have suggested that I should remove this screen so that you can see the picture more properly. So I'll make it more easier for you. This video is going to be related about suture materials, a very recent topic, and they are very fond of asking these questions. So you should have a general idea of the suture material, where they are used, how many types of suture materials are there, what are the absorbable ones, what are the natural ones, what are the non-absorbable ones. I will try to detail all of them, so stay with me. First, we'll make you see one simple classification of suture materials, like you can see, based upon the origin, absorption, and the fiber construction. Origin, natural or synthetic. Absorption, whether it is absorbable or non-absorbable. And fiber construction, whether it is multifilament or monofilament. Okay, so I'm going to remove my picture. So yes, it is done. So basic concept about suture material is that they should be at least as strong as tissue in which they are being used. And what happens is, when you remove these sutures by the end of second week, most of the skin sutures most of the skin gains is strength, that is the tensile strength of 3 to 7%. By third week, 20% of the tensile strengths come, and by fourth week, 50% of strength is gained. A wound never gains more than 80% of the tensile strength of the intact skin. You all know it by the pathology. Now there are some concepts that ideal suture, how should be an ideal suture be? So it can be one of the important questions. So tensile strength, tissue bioavailability, low capillarity, good handling and knotting properties, sterilization without deterioration of properties. So these were some of the important characteristic of ideal sutures. Non-allergic, non-electrolytic, non-carcinogenic, should be used in any operation, low cost, should not fray, should slide through tissue readily, and should not slip after time. Should be readily visualized, should not shrink, should not be extruded from the wound. On breakdown, it should not release toxic agent, it should not disappear without excessive reaction once its task is complete. So these were some of the important characteristics which can come as a simple MCQ in your exam. Now, according to structure, if you classify them, very important classification is there for monofilament and multifilament. According to the fate, absorbable and non-absorbable. It is not that any suture will remain throughout the life. So when you say it is non-absorbable, when it maintains its tensile strength for more than 60 days. Okay, and according to coating, it is coated or uncoated. So further, according to source, natural, synthetic, metallic, and in natural. Now this is something important. I would suggest you to take a copy and pen and note it there, the absorbable and non-absorbable. Some things you need to note and revise for your further revisions. So among absorbable and natural, catgut is there. Catgut, so cat, from cat you come to natural, and it is absorbable. Chromic catgut, collagen, fascia lata, kangaroo tendon, beef tendon, cargile membrane. Non-absorbable, you all know, must have used a lot in gynae: silk, silkworm gut, linen, cotton, ramie, horsehair. Okay. Synthetic, in a similar way, absorbable are more important, like polyglycolic acid, polygalactic acid, vicryl. You must have used, very commonly used, polygalactin 910, then polydexazone and polyglycaprone 25. Non-absorbable, you all know, nylon, polypropylene, polyester, polyethylene, polybutyster, and polyvinylidene fluoride या PVDF suture. Now one by one I would try to give you a gist of everyone. So this is what they mean by monofilament, a single filament of suture material, and multifilament, there are fibers intermingled between them. So monofilament have some advantages and some disadvantages. They are smooth, less tissue trauma, no bacterial harbor, no capillarity. Disadvantages is they are difficult to handle, and knotting it becomes loose. They stretch, and any nick or crimp in the material leads to breakage. So if monofilament you consider, so which are the absorbable monofilaments and which are the non-absorbable ones? So surgical gut, plain or chromic, polydexazone, polygalactin 910, that is the vicryl. So vicryl is one thing which they may ask you, because it is a very commonly used suture material. So vicryl is monofilament, absorbable, synthetic. Non-absorbable are polypropylene, polyester, nylon, polyamide, and PVDF sutures. Multifilaments have their own advantage and disadvantage. They have more strength, they are soft and pliable, good handling, good knotting, but their tissue reaction is more. Bacterial harbors, capillary action, tissue trauma. You you prevent them, means you hesitate to use them in a infected wound, because they will cause more tissue reaction and they will harbor more bacteria. Now multifilaments, if you see example as absorbable, are that same. Vicryl comes both as monofilament and multifilament, so it is here also in multifilament absorbable, as well as polyglycolic acid. Non-absorbable are the silk, cotton, linen. So you will come to understand more as I will discuss them in my future slides. So same thing, monofilament, multifilament, some advantages, some disadvantages you can see. Monofilament, handling difficult, smooth, strong, no wicking, thinner. Multifilament, handling is easy but low strength, wicking is a problem, and thicker. One more classification or categorization exists depending upon the United States pharmacopoeia, class 1, 2, 3. So it's very easy. Class 1 is silk or synthetic fibers of monofilament with twisted or braided construction. 2 में क्या होता है, कॉटन या लिनन फाइबर होता है जिनका की स्ट्रेंथ जो होता है, that is the fiber strength in which the coating does not contribute to the tensile strength. और 3 तो बहुत ही ईजी है, जस्ट मेटल वायर और मोनोफिलामेंट्स होते हैं, तो वो क्लास 3 होता है. कुछ प्रिंसिपल ऑफ सुचर सिलेक्शन होता है जो आपको पता होना चाहिए कि किस पे डिपेंड करता है. सो बेसिकली इट डिपेंड्स अपॉन द टिश्यू विच यू आर गोइंग टू सुचर, the properties of suture material, the condition of the wound, whether it is closed or open, infected or not infected, the probable post-operative course of the patient, whether the patient is good, they have good healing property and immunity and all. So rate of healing of tissue is important. So I'll tell you how you will decide which material to use and in which condition. So tissues that ordinarily heal slowly, such as skin, fascia, टेंडन, उसमें आप क्या करेंगे, उनको आप एक नॉन एब्जॉर्बेबल सुचर से सुचर करेंगे, बिकॉज वो स्लोली हील करेंगे. दे नीड सम टाइम टू गेन दैट टेंसाइल स्ट्रेंथ. सो नॉन एब्जॉर्बेबल सुचर्स, एंड यू विल क्लोज इट क्लोजली. टिश्यू दैट हील रैपिडली, सच एज पेरिटोनियम, liver, स्मॉल इंटेस्टाइन, मसल, स्टमक, कोलॉन, ब्लैडर, इनको आप एब्जॉर्बेबल सुचर से सुचर कर सकते हैं. Suture should be stronger than the sutured tissue. It is also unwise to give more of the implant, that is, more suturing is also unwise. Now, tissue contamination. You will avoid multi-filament sutures in case of contaminated wound, as already told, because the chances of harboring bacteria over the suture material will then increase. Okay. So use monofilament, absorbable or non-absorbable suture in potentially contaminated tissue. And if you see monofilament, polypropylene is ideal. In cardiovascular surgeries, monofilament, polypropylene and polyester coated and uncoated and braided silk are recommended. Now, monofilament polypropylene, being smooth, possesses high tensile strength, is the material of choice for vascular anastomosis. So this makes an important MCQ for your NEET PG. They may give you a picture showing two blood vessels being stitched. So there you can answer this, that monofilament polypropylene is the ideal suture material if they ask. Polyester is preferred for suturing artificial heart valves, myocardium and vascular prosthesis. Microsurgical procedures commonly used sutures are 10-0 polyamide monofilament. As the number increases, the suture material becomes more thinner. So if you are going to suture on face or you are doing some plastic surgery, you are going to take a larger number suture material because it will be thinner and thus give less scar. Like 6-0 will be thinner than 5-0, 5-0 will be thinner than 4-0, 4-0 will be thinner than 3-0, and 1-0 will be, or 0 will be just the thickest one. So wound repair following irradiation. Now in those patients, not only normal healing process is delayed, but also the tolerance to trauma of the irradiated tissue is reduced. सो आपको यहाँ पे एक्सट्रीमली केयरफुल रहना है एंड अवॉइड करना है टेंशन सूचर्स एंड मैट्रेस सूचर्स, एज दे विल फर्दर इंक्रीज द डिग्री ऑफ इश्कीमिया ऑफ दैट टिश्यू. प्रिंसिपल क्या है? लेयर्स में क्लोज करिए. इफ एनी वुंड आप क्लोज कर रहे हैं, नॉट टू बी sutured in one layer, close it as its natural anatomy. Avoid continuous and constant pressure on the irradiated tissue, and facial layers, non-absorbable sutures, that is the polypropylene is the ideal one. Selection of suture material is based on, already told, condition of the wound, tissue to be repaired, tensile strength of the suture, not holding characteristic of the material, reaction to the surrounding tissue. Biological response of body to suture material. So अगर आप देखेंगे, you should know the steps in which our body reacts to this suture material. So initial response to every suture is almost identical in first to 7 days. So होता क्या है? Early response is just a generalized acute aseptic inflammation. Inflammation होगा but aseptic होगा, involving primary polymorphonuclear leukocytes. कुछ दिन बाद mononuclear cells, fibroblasts and histiocytes become evident, and capillary formation occurs at the end of this initial phase. Now, what type of reaction body shows means how the degradation of suture material occur. So very important, and remind it, make a note of it, that natural absorbable will have a proteolytic degradation, which will be intense tissue response. Synthetic absorbable will degrade by hydrolysis, and this is less intense tissue reaction. Non-absorbable will show degradation by encapsulation or acellular response. So these are very important, can be 3 different MCQs for your exam. See, this topic is very rarely touched, but believe me, it's very important, and most of the people don't have any idea of these things. So it will be a very important thing for you all. Absorbable, natural. Now I'll tell you little things one by one about each suture. Now catgut is absorbable and natural, as already told. So by catgut, don't get this idea that it is derived from cat, while it is derived from sheep intestinal submucosa or bovine intestinal serosa. Okay, होता क्या है? Submucosa of sheep, इसके पास रिच इलास्टिक टिश्यू होता है, विच अकाउंट फॉर हाई टेंसाइल स्ट्रेंथ. ये monofilament होता है and is available in plain as well as tanned in chromic acid. The tanning process, what it does is it delays the digestion by WBC's lysozymes. Catgut should not be boiled or autoclaved as heat destroys its tensile strength. Catgut is sterilized by preparation during preparation and kept in the preservative solution, that is isopropyl alcohol. मतलब अगर आप ओटी में कैटगट को खोलेंगे, it contains some liquid, so you might wonder what that liquid is. So it is basically isopropyl alcohol. Okay, so unused or reusable catgut is hygroscopic. होता क्या है, they will absorb water and it will reduce the tensile strength. Absorption 40 to 60 days, and when placed intraorally, sutures are digested in 3 to 5 days. So don't worry about this absorption and all. I'll give you one chart in summary. From there you can note it or just click a screenshot to remember you. So this is something called plain catgut. So this is the look of plain catgut. Now moving to other, that is the chromic catgut. So if you see chromic catgut, some more thing about ki color is yellow and chromic is tan. Absorption is by proteolytic digestion, you already know. Chromic catgut में क्या होता है, it is coated with thin layer of chromium salt solution to minimize the tissue reaction and increase the tensile strength. 10 to 14 days is the tensile strength, and absorbed in 90 days. Used as ophthalmic surgeries, oral surgeries, and suturing the subcutaneous tissue. This is the chromic catgut picture you can see. As it is an organic material susceptible to enzymatic degradation, it is packed in isopropyl alcohol. Same thing, suture absorbs alcohol and swells. It is combustible, irritating, and all. Now another type of sutures are collagen sutures. By name you can see it is natural and absorbable monofilament, obtained by homogeneous dispersion of pure collagen fiber from flexor tendon of cattle. Absorption 56 days, tensile strength 10 days. Ophthalmic surgery, disadvantages premature absorption. This is the vicryl which I was telling you important for your exam. It is both coated and uncoated, and bivicryl you should have a thing that it is a synthetic and absorbable. Monofilament, multifilament, both are theirs, and lactide has hydrophobic qualities, delaying the loss of tensile strength. 14 to 21 days, and absorption by 56 to 70 days. This vicryl, being a synthetic, has minimal tissue reactivity and can be used in infected tissue. Available in purple and undyed. Undyed is used in case of face. Coated with polygalactin 370 and calcium stearate, which allows easy passage through tissues as well as easier knot placement on skin wounds associated with delayed absorption as well as increased inflammation. So you can use this vicryl, very useful. And something called vicryl rapide. So what is it? It is braided synthetic absorbable suture material which has similar initial tensile strength as normal vicryl, but what happens is its absorption is associated with minimal tissue reaction, facilitating improved cosmetic and reduction of post-operative pain. ये 12 दिन तक support देता है, and 50% of the original tensile strength remains up till 5 days, and all of it is lost after 14 days. So how it looks like, we'll show you. Absorption time is complete within 35 to 42 days, and it has a rapid absorption rate, ideal for intraoral and dental use. Something called vicryl plus is also there. So what happens, by what you mean by plus? Plus means ki you have something which is creating a zone of inhibition around the sutures. So what is this? So it shows that triclosan on vicryl. So if you give triclosan on vicryl, it gains more antibacterial properties. So vicryl plus looks like this, and it has antibacterial properties. So it's a very nice material to use in case of contaminated wounds. Now glycolic acid homopolymer or Dexon is a polymer of glycolic acid with greater knot pull and tensile strength than GET. So we are talking about synthetic and absorbable as well as braided. So any synthetic will absorbable will absorb by hydrolysis, braided so catches on itself and does not tolerate wound infection and nor the percutaneous suture. So Maxon, glycolic acid polyglucoglyconate. It is also synthetic and absorbable and monofilament, and in a similar way hydrolysis occurs. PDS2, so it is also synthetic absorbable monofilament, and these are the things you may note it down for future reference. It has a significant memory, minimal tissue reaction for wounds under tension, and contaminated wounds may extrude to the wound over time, so use only in tissue deeper than subcuticular layer or in phase 6-0 is used if used. So PDS2, synthetic and absorbable. So this was the chart I was mentioning to note you down, for you all to note it down. So it mentions the effective wound support in terms of date and absorption of mass. So PDS2 sutures have maximum effective wound support of 60 days and absorption of mass by 180 to 210, while coated vical rapide suture, as already rapide is in name, it is the at least effective wound support and absorption by 42 days. So you can note them down or click a picture or screenshot of it. So coming to non-absorbable sutures, very important now. Natural synthetic metal. So note it down in whatever book, copy or page you are having. Natural are all the silkworm, gut, cotton, ramen, linen. Synthetic already told: polyester, polyamide, polypropylene, polybutyster, polyethylene, and metal: tantalum, platinum, silver foil, gold, aluminium. So many na. So surgical silk. These are braided or twisted, made from filament spun by the silkworm larva to form cocoon. हर फिलामेंट को प्रोसेस किया जाता है जिसमें से नेचुरल वैक्सेस को निकालते हैं, और after braiding these strands are dyed, stressed and impregnated with mixture of waxes and silicone. Dry silk suture is stronger than wet silk suture. So this is how this silk looks like, and this should not be sterilized with this reel. Do not sterilize on reel. Okay, so advantage क्या होता है silk का? These are easy to handle, more for braided, good knot security, made non-capillary in order to withstand action of body fluid and moisture, cost effective, सस्ता होता है, बहुत महंगा नहीं होता, and in infection you cannot use them. Okay, because these are natural and non-absorbable. So natural will cause more tissue reaction. कहाँ पे यूज़ कर सकते हैं इसको? This can be used in plastic surgery, ophthalmic, general surgeries, ligating body tissue. Although characterized as non-absorbable, study shows that it loses most of its tensile strength after 1 year and cannot be detected in tissue after 2 years. Similar way, surgical cotton is a natural multifilament, non-absorbable. It comes from Egyptian cotton fiber, not good in contaminated wound, rarely used nowadays. Linen, for ligation of superficial vessel, mucosal suturing without strength, not used nowadays very much. Natural multifilament, non-absorbable. Now this is something very important, very beautiful suture. If you have seen it in real, it looks very beautiful. So this is blue colored proline, that is polypropylene, polymer of proline, inert and tensile strength for 2 years, hold knots better than any other synthetic suture. So this is another important suture for you, proline. Minimal suture reaction, so used in infected and contaminated wound. Do not adhere to tissue and is flexible, so used for pull out type of sutures. General plastic, cardiovascular surgeries, skin closure, ophthalmology, in every case it is used. This is what it looks like. This beautiful strands of monofilament proline. This is a synthetic non-absorbable suture. So this is how it looks like. And you can also In case of trauma cases, the cartilage, like if thyroid cartilage is injured, you can just oppose it by suturing the periosteum of them with this proline. So nylon is something important. Nylon braided or surgilon, synthetic but non-synthetic and non-absorbable, braided with silicone, sealed with silicone coating. Multifilament nylon is weaker and less secure when knotted, and it has little advantage over monofilament nylon. Now nylon monofilament or ethylon is something which is other very important and most commonly used sutures. So ethylon, vicryl, silk, and what is called proline. So these were very important, you should remember them. So ethylon or nylon monofilament is uncoated but inert, non-irritating to tissue, high tensile strength and low tissue reactivity, some memory, and return to original linear shape over time. Because of this, more throws is indicated, that is, for knot at least 4 knots you should tie them when you are using ethylon. Moistened nylon monofilaments are most easily handled and packaged wet. Skin closure, retention, plastic, ophthalmic and microsurgeries. So in case of emergencies, when you get a trauma case, you suture the skin with ethylon, synthetic and non-absorbable. So polyester, braided. So these are multi-fibers of polyester, excellent tissue reactivity, and what you can see is these are more expensive and in deeper layer may last indefinitely. So polyester braided. Gore-Tex is a non-absorbable synthetic monofilament suture. ये किससे निकलता है? From expanded PTFE, extremely low tissue reaction, good knot tensile strength and easy for handling. ओके, कार्डियोवैस्कुलर सर्जरीज और सॉफ्ट टिश्यू अप्रॉक्सीमेशन में गॉटेक्स को आप यूज़ कर सकते हो. मोनोक्रिल इज एब्जॉर्बेबल सिंथेटिक मोनोफिलामेंट, हाइड्रोलिसिस से जाता है 90 to 120 days, मिनिमल टिश्यू रिएक्शन एंड मोस्ट प्लेएबल मटेरियल एवर मेड इज मोनोक्लिर. Now this is something very new, polybutester or novofil. इसका यूनिक फीचर क्या है कि इसका एबिलिटी होता है कि ये इलोंगेट हो सकता है. सो नन ऑफ द मटेरियल हैज़ दिस एबिलिटी, बस दिस इज अ न्यू मोनोफिलामेंट, नॉन एब्जॉर्बेबल एंड सिंथेटिक, एंड द मेन थिंग which makes it important sorry which makes it important is its unique feature that it can elongate and stretch with increasing wound edema. When edema subsides, suture resume original shape, and so it is an ideal suture for laceration secondary to blunt trauma. Okay, so important for you all. Minimal tissue popularity in cutaneous surgery is gradually increasing. So last is the surgical steel. So it is also good one, natural, monofilament, multifilament and non-absorbable. So alloy of iron, nickel, chromium are being used. Good tensile strength even in infection, but these are difficult to handle. Tendency to cut through tissue, very hard to tie, and knot ends require special handling. Potential to corrode or break at points of twisting and bending. Not to be used with prosthetic of another alloy. Used in abdominal wall. कहाँ पे यूज़ कर सकते हो? Abdominal wall and skin closure में यूज़ कर सकते हो. Sternal closure में यूज़ कर सकते हो. Lot of pressure is needed. Retention, tendon repair, orthopedic and neurosurgeries. Splints, arch bar, ये सब में भी यूज़ कर सकते हो, but not as a suture material. Just to hold them you use. Disadvantage क्या है? यहाँ पे linear artifacts हो सकता है by substances. CT images में CT करोगे, वहाँ पर artifact मिलेगा around these wires. Possible movement of metal suture during MRI because of their magnetic property. Patch test for nickel sensitivity should be done before using. So this is a general picture to tell you what to know from this suture material coat. So this is just a labeled one to make you know. This tells you the batch number. This is very important. The expiry date you should know for every material before using them. This thing tells you that you need to see instruction before it's used. This symbol is for showing you that do not reuse. See, they have cutted this reuse. EO is ethylene oxide for its sterilization, and it is sterilized. Then this is the needle profile, needle tip, needle type, the needle size, and the curvature from which end is cutting, whether it is reverse cutting or the simple cutting one. Then the metric gauge and the imperial gauge of the material. So regarding suture materials, those are also important, but I will make them in another video. I do not want to prolong it more and make it more boring. This is another picture, just a summary one. I want you all to make a screenshot of it also and revise it. So I hope you have been helped with suture material, and now you just have a general idea for your NEET PG exam before going or attempting this exam. And remember my word that अगर ये काम करना है तो करना है, पीजी निकालना है तो निकालना है, लड़की पटानी है तो पटानी है, पटाऊंगा. Okay, so this is Dr. Shivam signing off and wish you all the very best. Thank you.